And we're going to open you up here and we're going to drain it. Are you ready, Numbers?
Yes.
Yes.
And got Jenny on the cam. And you're okay if we video your procedure for all our friends on YouTube and internet?
Yes,
and for your darling wife, right?
Girlfriend, yes.
Oh, girlfriend. Does your girlfriend know about your wife?
No wife.
Wait a second. Let's get. There's no wife. Okay, for clarification, let's get a little betadine on here. This is a clean procedure, but it is not a sterile procedure. It's impossible to have pus on the table and have a sterile procedure. Okay, just can't do it. Pus itself ruins that. So we're gonna make an incision first. After we numb it, Jenny, you're gonna watch. Everybody see okay?
Yes, I'm very
What's he gonna feel?
Stick, sting, and a burn.
Stick, sting, and a burn. Here it goes, Mr. Numbers. That blanching effect is just the turgor pressure changing as the medication infiltrates the interstitial space under the skin. That's what you're seeing. Isn't that right, Jenny?
Yes, sir.
That's what Jenny told me before anyway. I didn't know. She says, no, Dr. Gilmore, that's the interstitial space being invaded by the anesthetic. Should be 1% with epi, right?
Yes.
Gummy
Yes.
All right. And I'm not trying to get any of the medicine into the cyst itself, right? We've got plenty in there, I'm sure. How you doing, my friend?
I'm doing good.
You feeling that medicine going in? Slowly?
Yes.
Yeah. That's what we want. You should feel a little bit of it. We just don't want it to be terribly painful. How much did you get in total, Gummy Jean?
6.
6 cc's. All right, let's put that there. There's my flush. You got that one off the table? Okay. There's more if we need it. Did I put the big one in? Is that what you were going to tell me? That's okay. Yeah, he got it all right.
Okay.
Let's put a little more in anyway. Yeah. I want a little bit more on the side over here. There we go. Makes me feel better. I don't want you to have any pain, my friend.
All right.
And Jenny, once we get to the end of the anesthetic work here, you can stop the camera real quick and we'll let it kind of soak in for a few minutes. We'll let it really do its job before we make the first incision. Okay?
Yes, sir.
He was apologizing earlier. I'm like, what are you apologizing for?
There we go.
Because this is
You good?
disgusting.
We are well anesthetized. Now we're going to stop. We're going to stop for about 5 minutes and let. We're back. We're back with Numbers. Numbers, are you ready?
I'm ready.
And he did say it was okay if we videoed, didn't he?
Yes.
We're going to make an incision with a number 11 blade. And if this sprays all over me, it'll just be part of the job. I know this is going to come out pretty forcefully. At least that's what I'm expecting. I'm not expecting this to be pretty.
Not feeling any pain, are you?
No.
I'm ready.
You're ready for the
Yeah.
pus? Okay. See, now this is definitely pus coming out. See the color, Jenny?
Yes, sir.
You got a culture egg for us, Gumby?
I do.
Just get a culture egg going on that. And you can always tell the color. You know, some of these wounds, these epidermoid cysts will have liquid in it, but it's not pus. Okay, when it's this creamy yellowish kind of stuff,
Ah, yes.
that's definitely pus. So we're just slowly applying pressure because we don't want this to go flying out and get into Jenny's nose, right, Jenny?
My crazy Asian nose.
Your crazy Asian nose. You haven't even seen the movie yet. You're not allowed to use it yet.
Whoa, look at that. That was.
Oh, no.
Gotcha.
That's what I get for not wearing something on my sleeves.
What got on your
You got on my hand.
hairy arm?
Yeah, thanks, Jenny. All right.
Gonna feel better after this, my friend.
Looking good. This is a good video.
Yeah. You know, the good thing is this does not have a terrible odor. I expected it would be pretty strong.
Yeah.
I'm gonna open this a little bit larger now. A little bit bigger opening. You feeling anything, bud?
No.
You're just feeling the pressure, right?
That's correct.
We're gonna need a couple of those really large cotton-tipped applicators, Gummy Jean.
Really large.
The really large ones. You know. the ones I'm
Pap
talking
smear one.
Okay.
Yeah. Well, I wasn't gonna say that, but
Yeah,
I
I
guess,
didn't want to say.
I guess Jenny did. So
It's very.
yeah, we're just squeezing out more now. So we want to definitely get in there and open this up more. This has got a pretty big space in here, numbers. Did you feel a little something there?
Yeah.
Okay. When Gummy gets back, I'm gonna add a little bit more medicine. I think I just got into an area that wasn't quite anesthetized. Anesthetized. There we go. I just know I'm a target right here. Yes, perfect. We don't want you in pain. I mean, we want to have a good time and everything, right? But we don't want you to suffer. Besides, your girlfriend needs a good video, right?
Yeah, she's definitely gonna watch this.
Yeah, that's what I want to hear.
No, I don't. I'm not watching this.
Oh, come on, your own cyst?
Yeah.
Infected? Your own infected cyst, and you're not even gonna watch it?
Mm-mm.
Come on, man.
All the pain, the blood, sweat, and tears you
Yeah,
have to
man.
go through.
Come on.
No.
Well, you don't have to. That's the beautiful thing about it all.
He said he don't want to bring up old stuff.
You don't want to live in the past, right?
Yeah.
Yeah, we got a lot of stuff in there. Jenny, don't let me get in the way, okay?
No, sir.
All right.
I have my view very clear.
We have a curette. We're just going to work some of this out of here. We don't expect to be able to get all of the sac out because of the infected nature of the wound. The fact that the anesthesia does not work as well when there's a concomitant infection. So what we're going to do is we're going to scrape as much out as reasonably possible here, and then we're going to pack this wound and let it heal from the inside out, and hopefully this won't come back. How you feeling? Feeling better now, buddy?
I'm good.
Good. It kind of looks like sac there, but there's scar material in there. Yeah, that's just scar. A little bit of sac.
Oh,
Gotcha?
yeah.
Okay, we won't go over there.
Okay.
Work over here a little bit. Let's try sensor here. This still feels kind of full, Jenny. Do you think there's anything else in there? Or just the
Maybe.
sac, maybe? More of the inflammation that we're dealing with. Let me have one of the small. We're not ready to pack yet. I want to do a flush first. Yeah. Make sure we don't have any loculation. So loculation just means a pocket. I know you're a little tender on this side over here, so I'm not going to push very far. Take a deep breath for me, bud. I think we've given you about 10 cc's, so there we go. Okay. Let's pack this now. So I really don't believe we have anything else in there.
Some waste.
No, we don't. There's nothing left in there. It's just a little bit of edema. Okay, let's get the pack.
More?
Yeah, we're gonna need more. Yeah, that's good. Cut that. Thank you kindly. Can you see all right, Jenny?
Yes, sir.
All right, so now we're packing iodoform gauze in here, numbers. This is gonna help this wound stay open and heal from the inside out. You got a lot of kind of fragile sac material. I don't know how much of a cyst you had before this got infected. It's really difficult to say, but I can tell you it looks like there's some scar tissue in here, so this may have been here a while. Take a deep breath for me, bud. Yeah, I don't want you to feel pain, but I've also given you lots of numbing medicine, and just because the infection's not working very well. So the best thing we can do right now is just get this done quickly, which we're doing.
He's doing
Deep
really
breath.
good.
He's doing great.
Great.
He was hurting, that's why he came back.
Yeah, he got
Came back
his
sooner. We
turn.
were going to give this more time so that we could do a nice sac removal and everything. He's like, I can't deal with the pain. And the size too. The fact that it was so big was pushing against your clothing and everything, right?
Yeah.
Pushing against the seat when you'd sit, that kind of thing.
Yeah, laying down.
And he
So-
couldn't work out.
He's more worried about the working out part than anything else. All right. So, oh, we didn't do the flush. Well, that's no fun. So we're gonna put a dressing over this and see you back tomorrow, okay, buddy?
All right.
Stay real still. There we go. So everybody can kind of see what that looks like. But we'll hide the tattoo. All right, Numbers. Thanks for letting us do this on camera.
All right, thank you.
All right, bud.
Hey folks, you spoke and we listened. Here's what you had to say about Meta 7.
I love it so much. It gives me so much energy during the day.
I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And it could actually help you lose weight.
Now, I haven't taken a nap in 6 months.
That's right, Meta 7. More and more people are sending in their testimonials. Weight loss, more energy, and generally feeling more alert during the day. Let's hear more.
I used it to help wean myself off caffeine and energy drinks, and my productivity has been very high lately.
It's natural, it's amazing. I feel motivated to get out and do things that I didn't before.
I'm not tired during the day. I've worked 12-hour shifts.
Just go all day. It makes me feel great. I love it, and take it. It's wonderful stuff.
If you haven't tried Meta 7 yet, it's time to order yours from Amazon. Time to boost your metabolism and kick your energy level into high gear. There's an Amazon link in the description.